Keys to success number 115, January of 2018. I'm Dr. Martin Rutherford, certified functional medicine practitioner, a chiropractor.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
So some of this is going to be repeat. It's post January 1st. It's now January 2nd. And we're going to talk about some of the more common topics that you'll hear at this point in time, particularly for our patients. We're going to talk about New Year's resolutions and maybe a little bit more refinement on a topic that we just did a couple of weeks ago on how to proceed if you have not listened to our recommendations and exceeded your limits in eating non-gluten-free products or other things that maybe would have thrown you off your program over the holidays. So, and we have a relatively unique perspective on setting goals for the new year, and it's based on observations that we've made of our particular patient population. Which is a unique patient population of chronic pain patients. People are under chronic stress and several other characteristics that have combined to lead to the symptoms that people present with in this office. So how would you suggest, which one do you want to go over first? Do you want to go over goals first?
I think I want to go over goals first. I think keeping goals simple and more directed at staying on your program, staying on your diet, things that you can actually control tends to work better for our patient population. The things that we see as a kind of a danger zone, so to speak, for a lot of patients is that they say, okay, I'm starting into this process, 4.5 months, I got to be better. Or, 2 months, I want to be this much better. And that's just not the way the program flows for a lot of people. So eliminating expectations of how it's going to go, what's going to happen, because you can't control whether you're going to get a nasty upper respiratory tract infection, flu, gastrointestinal problem. Right now, there's this upper respiratory bug going around that seems to have people coughing for 3 to 4 weeks. So that can compromise a large period of your program. We're used to that, so we can adjust, so to speak, when all these variables come in, but you eliminating those expectations will be one of the best factors for you to succeed. And
we do talk about this in the beginning, and when you first walk in and we talk about your program, just to remind you, okay? And we talk about a lot of things over those first couple of days, but it's the part where I say, here's how you get better. You'll have good days, you'll have bad days, you'll have good days, you'll have bad days, and then maybe there'll be a flu, maybe there'll be a stress, maybe there'll be a bacterial infection, maybe there'll be something like that that'll throw you off your program. And we do our best to adjust for that. And then, I don't know if you remember, but I said maybe you get to 4.5 months, 6 months, 9 months, wherever you're supposed to be. And I will frequently say, it's not that you'll be all the way there because there's so many variables involved, but usually at that point in time, you'll have the tools to understand how to take that, how to take that and continue to get better. And that sometimes it'll take another year to a year and a half to 2 years for the person to actually get to the point where everything's really stable, but you'll have the ability to understand what's going on and when you're having bad days, why you're having them, and then go to your keys to success. Or just look around and see what you ate that you shouldn't have eaten and things of that nature. So, and I'm only saying that because we do kind of say it in the beginning to let people know what realistic expectations are, because everybody's different. Everybody's physiology is different. Nobody knows everything about the body yet. Nobody knows everything about healing yet. We give you recommendations on like, let's say the vast majority of the people that come in. Let's say 80% or 70% of our patients go this way, and then 30% have to be managed more acutely, take longer, have more ups and downs, but we'll get there if they stick with it. So goals, exactly. I'm with you on the goal, on the I'm going to be better at this point in time, and I'm going to be back to marathon running in, in 4 months.
Yeah.
Those are bad goals.
The goal is to do your diet that you've been recommended to do, take your supplements as directed, and do your brain exercises. Kind of let everything else fall into place.
There you go.
And then, yes, if you've deviated over the holidays, we'll kind of reiterate what the plan is. If you've gone off the diet, so to speak, you had a few cookies here, a bite of cake there. Again, minuscule amounts of gluten can be problematic for a lot of you. So in that event, we recommend you come in, get Repair Vite, take a half scoop twice a day. And then also, if you have had gluten, it wouldn't be a bad idea to get gluten flam, and you can take 1 cap 3 times a day until the bottle is gone. And those should help you to feel better and get out of any food reactions that you had. Now, if you have another issue going on, then let us know what it is. But if you just went off the diet and that's what you did, then you can just do those simple recommendations. So, anything else you want to add?
No, I think that covers it.
Okay, we'll see you next week.